Hong Kong, the healthcare system is always depend on the private sector and the public sector. So 90% of the patients are serviced by the public sector, and it's virtually free. So, but as you know, as you expect, because if everything is free, then more and more patients would just take care of this. And so the private system is to allow patients who can afford to have options of selecting the doctors or the mode of treatment, and so there's a private service. So the private and the public is sort of a service system to complement each other. And the problem with the aging population, the problem with being more patients and facilities are sort of saturated, so the public service is a bit overloaded at this point in time. So I think part of the reform and part of the government point is to see if we could encourage more people to buy insurance or medical health insurance, so that more of the people who would be able to make use of the insurance coverage and to make use of the private facilities. And so in doing so will help lessen the load of the public hospital for patients who really do not have the financial means to be able to do that. So many patients who really cannot afford insurance or cannot afford private medicine to be served in the public sector. Right. So, as an aging population, you would expect the demand to be growing. More people get older, they get more disabled, they get cancer, and all the medical demands will be more. And so it's a system which needs to increase the capacity to serve the patient. But even so, the advances of medical sciences, which means for the quality of health nowadays, and of course, you don't have to wait until you're blind before you do the cataract. You don't you get pain in the joints. I mean, you want to replace the joints, and so many of the treatment can affect the quality of life, and so there are many more treatments for you to, not only to prolong your life, but to prolong your activities and your quality of life for a period of time. So I think the population grows, population ages, the patient expectation demands are higher, there are more medical care we can give the patients, and so even the patients with cancer just 10 years, 15 years ago, there's only so much you can do, but nowadays you can try different cancer therapies and treatments. And well, I think we're one of the few practice was one of the first department to build up into a multi-specialty. So first, back in 1997, we were one of the first to introduce, say, the LASIK surgery into Hong Kong, imported technology which opened up this refractive surgery. And over the past 20 years, we had developed into a very large eye department of multi-subspecialties. So that instead of having just a number of eye doctors, we have increased the expertise in, say, glaucoma, in vitreoretina, in plastics, and refractive surgeries, and pediatrics, and so forth. So that not just expanding the number of doctors, but also expanding the expertise to cover the various aspects of eye diseases. We were never a brand back in the old days, you see. It's only in recent years that you call us as a brand. So in terms of the survival of 95 years, obviously, as going through the times, you have to make changes and adaptations, and it's never been, well, that's part of my lecture later, is to tell you what we have gone through over the 95 years. So it's in change of going through up and down political, socio-economic changes. You have to have sufficient amount of service differential to be better because of the doctors, the service, the experience, and whether it's value for the money. So this is part of the system is to look at the service, the patient service, look at the patient safety factors, whether we can provide meet the expectation of the patient, since they're paying for the money, so you have to deliver, you see. So they have to have the perception that by paying the money, they're getting the best care. And if you can do that, then you can have this brand management. So it's all a continuous process on how to increase the peer standard to the doctors, how to improve on our nursing service and nursing support, and how to make sure we keep updated with the equipment and facility. You see.